I don't see any other questions in the chat. So I think this then concludes our session on Category 2 strategy. Next, we're going to hear from Jay Rubois, our Director of Organ Procurement, and Steve Mansfield, our Director of Tissue Services, who will talk to us about Category 3, customers. This category asks about customer expectations and customer engagement. So as they're delivering their presentation, think about how your organization listens to and engages with its customers.
Thank you, Grace, and good afternoon, everybody. Thank you for joining us today in Category 3. My name is Steve Mansfield. I'm the Director of Tissue Services here at Donor Alliance. I lead one of the 2 clinical teams that integrate with our customers on a daily basis. I've been with Donor Alliance coming up on 23 years, and I'm looking forward to our time together this afternoon. I'm going to pass it over to Jay for a second.
Good afternoon, everybody. I'm Jay Rubois. I'm the Director of Organ Procurement. I lead the team that manages the organ side, the folks that go into the operating room and assist the surgeons with recovering organs for transplant. I've been with the Donor Alliance for 31 years. As we transition through and discuss Category 3, I look forward to our time with you. I'm going to pass it back to Steve to take us off.
Great, thanks, Jay. So over the next 35 to 40 minutes, Jay and I are going to discuss Category 3, which is entitled Customers, and how Donor Alliance define who our customers are, how we collect feedback, and how we utilize that feedback and integrate it throughout our system. Then we will demonstrate what impact it's had on our mission in saving lives. After the presentation, we'll be able to take questions or have further discussion on how voice of the customer feedback is integrated into our business model. Apologize, let me advance a slide here. Sure. All right, so as we get started, I'd like to bring us back to Donor Alliance's mission, vision, and values. I realize you've probably seen this slide a couple of times already, but it's important to ground us in the work that Donor Alliance does in saving and healing lives through organ and tissue donation and transplantation. We do this working with our customers, partners, and stakeholders to maximize all donation opportunities, ensuring people are receiving life-saving and healing gifts. Our mission and vision are anchored by our core values: integrity, leadership, excellence, accountability, and people first. With regards to our discussion today, we're going to focus on excellence and accountability to our customers. Apologize, we're trying to advance a slide here and it's not. There we go. All right. I'd like to start by bringing us back to the Baldrige framework, as it really helps organizations answer 3 main questions for Category 3. Is your organization doing what is necessary to ensure customer satisfaction? How do you know? What type of things are you measuring? And what should your organization improve or change? The Baldrige framework serves as a holistic, non-prescriptive approach focusing on interrelated processes and results. It is scalable and applicable to organizations of any size and from any business sectors such as manufacturing, healthcare, nonprofit, small business, education, and communities. Within the framework, more detailed questions are asked across 7 critical areas as seen on this slide: leadership, strategy, customers, which you've heard about today, then measurement, analysis, and knowledge management, workforce, operations, and results. Our focus today is going to be on customers within the framework. So I'm sure many of you have come across businesses where your customers are well defined. As an organ procurement organization, we struggled early on to define who our customers were. In fact, we spent many hours with our staff, leadership teams, and board of directors discussing and narrowing down who our customers are. Through that process, we asked ourselves who are our customers? The donor families, maybe the recipients, How about the hospitals declaring patients? Or the transplant hospitals and tissue processors? In the end, we came back to Baldridge's definition of customer, which is defined as the actual or potential user of your organization's offerings of products, programs, or services. This definition made it clear that we provide organs and tissues for transplantation, and our customers were, in fact, transplant hospitals and key tissue processors. This was a process for us, and it took quite a bit of time, and for many industries, this is a very simplified process. However, we all need to keep in mind who our customers are and remember that today, your customers may not be the same as they are in the future. Think about technology and how it's changed our world. Many people in the past experienced business as traditional commodities sold in stores. With the internet, customer bases are now available all throughout the world, which has drastically changed customer bases. When it comes to focusing organizational work, it's important for us to know and understand the key work processes used in delivering services. To break it down, our main service offerings at Donor Alliance are organs and tissues for donation and transplantation. The direct customers of the donated organs and tissues are our transplant centers and tissue processors. We rely strongly on relationships not only with our customers to understand what their requirements are, but also with numerous others to ensure donation process flows smoothly. Having clarity and focus on these key factors helps us define our work systems and related activities which provide favorable outcomes to our customers.
Collection of feedback. Now that we've defined our customers, we need to ensure that we're obtaining actionable feedback and prioritizing our resources accordingly to meet the customer's feedback. This category asks about our key processes for customer listening, customer engagement, and customer support. We have a number of different ways in which Donor Alliance uses to build relationships with our customers and listen to the voice of our customer. Some of these approaches include having 24-hour, 7 days a week on-call staff. We attend meetings, not only meetings at Donor Alliance with our customers, but meetings at our customers' hospitals, transplant centers. We have the ability for leadership to be on the phone and available to speak to our customers daily. Text is a 24/7 operation for us in listening to our customers. We also communicate and engage with them and understand their requirements through surveys, audits, and regular quality meetings. We conduct formal surveys to understand their satisfaction of our services. We also monitor our performance on a regular basis through scorecards. One of the methods that Donor Alliance uses to listen to its voice of the customer are videos. This is an opportunity to ask pointed questions, key questions to our key customers to obtain feedback that can be brought back to the Donor Alliance staff for, again, actionable requirements. The next two slides are an example of this. So what I want to do and set up for you is I want to share, we have a Donor Alliance staff that go out to our key customers and ask them these key questions. We record it and edit it a little and then bring it back and share it not only with the leadership, but eventually share it with the entire Donor Alliance staff. So,
continue doing what you're doing. We had an interview 2 years ago or something. I probably said almost the same thing. So I think it's really a mark to your leadership that there's consistency, and that you continue to be our partner of choice after these so many years. And so, yeah, I guess just keep doing what you're doing.
It's fabulous. We are so fortunate to work with such a professional team. Again, having worked with other teams in the country, Donor Alliance really stands out. Great teamwork, great partners. We've had great communication with all of the leaders. To make sure there's transparency, to make sure that we're working together for the greater good to increase awareness of donation. So we appreciate that.
And video number 2.
One of the things that I think that they're really good at is communicating. We text and phone each other multiple times during the cases. If there's changes that need to be made, OR times when they're set, if there's changes to the OR times, if we have to change the recipient, we're notifying them. They're keeping, and then, like I said, they're notifying us when there's changes that are made on their end of the case. During the OR, donor OR, if there's things that are happening that we need to know about, they are instrumental in keeping us aware, because sometimes the surgeons don't always do that. So it's kind of nice that Donor Alliance helps out and keeps us informed about what's going on.
Great, thank you. So I hope you enjoyed the video. So that is one of the methods that we use to listen to our customer. And what I want to do now is I don't want to explain the strategic planning process very well. What I do want to do is give you an example of something we heard at a time in Donor Alliance, heard on the voice of the customer, and how we brought it through our 9-step strategic planning process. So as you recall, in step 1, we gather and analyze inputs. So one of those inputs was one of the customers from one of our major transplant centers came to us and said, it might be possible if you bring and put a CT scanner in your freestanding recovery center. So Donor Alliance has its own freestanding recovery center where we transplant potential donors, medically manage them, and then take them to our own operating room for the recovery by the surgeons. One of our customers brought to us in a voice of the customer video the thought that if we were able to bring and put a CT scanner in our recovery center, learn how to do the imaging they require, which would help them, in a nutshell, visualize the liver in a way so that it could be successfully transplanted or split in the donor OR, that they might be able to save 2 lives. So what this does is help us, it goes back to our Donor Alliance's mission of our vision of maximizing all opportunities. And so what this would do is help us lead to more transplants from a single donor. Potentially, they also identified that there could be better outcomes. The liver could be split in the donor operation, saving significant amount of time in the recipient OR. So in step 1, again, in that step 1 is in the first quarter, so January, February, March timeframe. We got our voice of the customer videos back, and we started to think about what, was this an opportunity for us? In step 2, we brought the CT scanner at a high-level discussion with the executive leadership team and the directors. We thought about things like the cost. What's the cost of the hardware? What's the cost to bring it in? What are the training needs? Do we need to train our staff? We don't currently employ CT techs. Could this be a technique that some of our staff could learn? We also look at and reach out to our customers in this step, reached out to our customers and really looked at what could be the benefits to our customers, and really evaluated, will this help maximize the Donor Alliance mission? We brought the CT to step 3, which is in quarter 2. Again, in this step 3, we validate and develop the strategies. So we look really closely how this would assist the customer. We really start to briefly outline a process and a strategic plan. We start to basically develop a skeleton or a template for a budget. In step 4, again, ending towards the end of June, we reviewed the process with all of leadership. So originally it was executive leadership and directors. At this point, we bring it to the entire leadership team so that we can brainstorm. You know, there might be things that we're missing that the managers and all of leadership can bring to light. We continue in this step 4 to develop the process and really kind of pin down things like vendors. Who are we going to buy the machine from? Who are we going to have install it? What staff are we going to need to run this machine? Taking us to the 5th step, and this is where we really hone down and align the people, process, tools, and technology. This is a big high-level review because, as you recall, one of the final steps in the strategic planning process is to bring things to our board for presentation. So this customer's request in this 5th step, we really review and hone down on things that we have to consider: the people needed, the tools, the vendors, the software needed, or the reoccurring expenses, things like maintenance contracts we learned about, things like training folks to do limited study imaging. All of those is where we really hone down in this quarter 3 so that we would have something that we could eventually present to the board of directors for approval. And the 6th step, so this comes at the end of quarter 3. This is where we really validate. So after we put everything from budget to goals to performance measures, how are we going to measure the success of this with our customers? What are we going to ask our customers to really understand if this is of value to them, if this is something that Donor Alliance needs to continue? Again, in this final step, we've reviewed and put together all the strategic implementation plan, all of the goals and the budgetary needs. The step 7 is where, you know, kind of that success point, not success meaning it has been approved, but success that all the hard work for the previous 6 steps is put together. And the whole product is presented to executive leadership, and then executive leadership presents that to the board of directors for approval, hopefully approval, leading us to final step, which is step 8. And in this step, I'm happy to say the CT machine was approved. This is where executive leadership delivers it, you know, kind of in a reverse order. Deliver it to the directors, deliver it to the entire leadership team, and then we deliver it to the staff so that they can actually start working on all of those details we put together for implementation in the following January coming up. And this step 8 is, you know, in that last quarter, November, December timeframe. And then just to kind of reevaluate that step 9, as Matt had talked about, is where we really go through that, evaluate how we took the CT through that process. Did we listen to our customers' needs? Did we develop actionable items for our customer? What are cycles of learning that we could use to improve it, either with that product going through the strategic plan or in the strategic planning process itself?
So by understanding customer requirements and integrating them through our strategic planning process, Donor Alliance has experienced top decile performance within the organ and tissue industry. We know this based on our results, which is the 7th category of the Baldrige framework. It asks about levels, trends, and comparisons, and integration of results relating to the 6 Baldrige process categories. Through our intentional efforts to align, integrate, and improve our systems and processes over the last 13 years, we've experienced tremendous increases in organ and tissue donation and transplantation. From 2022 to 2023, we experienced more than a 10% increase in organ donors and organ transplants. Last year, 307 generous organ donors saved 918 people's lives through organ transplantation. Additionally, just over 1,700 tissue donors saved and healed more than 127,000 lives.
So I wanted to share you, as we start to wrap up and conclude, I wanted to share with you some lessons that we've learned through our review and understanding of Category 3. So one of the lessons is that your customers are always in a state of flux. At least we've learned that through our transplant centers, who are our key transplant center and tissue processors, who are our key customers. It's imperative for us to assess our customers' requirements on a frequent basis. The transplant industry is changing consistently. It can change monthly, it can change weekly, it definitely changes yearly. So really having that consistent and continual accessibility of our customers to Donor Alliance so that we can understand our needs is very important. It's very important for you to understand how that applies in your situation. The customer groups can train. So an example of that is the donation world has changed drastically over the 31 years I've been with Donor Alliance, and it's changed drastically just over the past few years. Our allocation system, which is the system in which we match the recipient with the donor, is a very complicated process, and it's changed. It's changed so that the right patients are transplanted, and that patient may be in another state. And so there's a lot of transportation. And so we've learned that our local transplant centers are key customers, but customers from other states are becoming more involved in Donor Alliance, and we're communicating with them more. And we've gone to the point where we've sent voice of the customer videos and gotten that information from those centers. So it's important to know your customer groups, and they can change. And it's important to leverage technology to ascertain your customer requirements. The standard survey or the standard phone call just doesn't always work. It's important to use every bit of technology and at every point in the day, not just on a quarterly or 6-month or yearly basis. We try to get information from our customers hourly, minute by the minute, by the hour, by the day, by the week. And what are some of the key takeaways? So some of the key takeaways that I'd like to share with you are that you should listen to are, what are your services that you're offering? I know this is basic, but it's very important to us, even though we provide organs and or tissues. What really we continually have that discussion. What are the services outside of that we offer? Who are your customers? Again, as I talked about, our customer base or customer group, as you might call it, has changed, and it's changed drastically. Who within your customer organizations are your customers? So who are the customers to the customers? I think that's very important. And we know that by going to meetings and meeting with all levels of leadership from all levels of the customer group for transplant centers, from staff to leaders. What are your key processes used for customer listening, customer engagement, and customer support? Really important to evaluate that. We do it through multiple methods and evaluate, are your current approaches effective? So again, as Matt and I've outlined, we continually review our strategic plan process to evaluate, are there cycles of learning, and are there things we can improve upon? So I'm going to hand it off to Steve to kind of close us out.
So I'd like to end with this quote: building a good customer experience does not happen by accident. It happens by design, which I believe represents the intentional efforts that we've made over the years. On behalf of those who have been touched by organ and tissue donation and transplantation, thank you. I think we're wrapping up here. We do have time for some questions, so I'm going to go ahead and hand it back over to Grace.
All right, so it's question and answer time again. So if you have any questions for Jay and Steve, please post your question in the chat.
While people are thinking of questions, we had James, who identified their organization's customers as patients and families and also payers. And then Rita identified that the town citizens are their customers.
Thank you, James and Rita.
Thanks.